Hi, everyone. Welcome back to Staying Compliant with KW Advanced Consultant. My name is Keisha Wilson, and I am the founder of KW Advanced Consultant. So we are happy to be here today, another day. We are here in New York. It's hot. It's a summer day, but we are staying cool. I hope everyone out there is staying cool as well. So we've had various series where we're talking about evaluation and management. And as some of you may know or may not know, I teach the CPMA and I also teach the CPC and various coding courses. And one particular area is the evaluation and management section that I always know that stumps people. And I had an amazing interview today with Sanal Patel, and we talked about evaluation and management codes. And I know I've been doing a different series and picking different areas regarding evaluation and management to talk about. So it inspired me to come on and, talk a little bit more. I've also been, as I'm teaching the CPC, teaching the evaluation management. Anyone that has taken that course know that the evaluation management section is actually the last. So although it's the first in your CPT book, it is the last section on the curriculum because it's a little tough for people to understand, right? We're navigating different categories and subcategories, and everyone may not get it right away. So they actually say that for last, even though it's the first in the book. But you really have to understand it. It's really important for you to understand the guidelines, to go through those guidelines in fine details, right? It's the first few pages before the evaluation and management section. There's a lot that's in green. That's why I'm wearing green today. Those greens for those updates. It was a big overhaul when we were talking about the 97 and 95 guidelines. Then we had the 2021, right, that affected the outpatient setting. And then there was that whole revision finally in 2023, where now we're all on the same page when it comes to the emergency department, the inpatient, and the outpatient services. So you always want to understand it, really take a highlighter, go through it. As I tell everyone, you may not memorize things and know everything right away, but you want to know where to go back and to read it and understand it, right? And sometimes it takes us a while to understand something, right? We have to read something more than once to really get it and grasp it. And besides reading it, you also want to listen to different things, right? Like this YouTube video, attend webinars, hear other people speaking, listen to the podcast, right? Paint the Medical Picture podcast is coming out where Sanal and I talk about evaluation management codes, and we take a deep dive, right? Part one about it. And that's because it's so intricate and there's so many different parts. And as you teach it, and I've been teaching it for years, I'm hearing different students complain, I'm hearing physicians complain, and there's a lot of gray area that we want to make it clear for you so that documentation is compliant and consistent. So remember, the documentation is the patient's legal record. So one thing I want to talk to you about today, and we'll take it in drills, in sections, and subcategories, but let's talk about a problem. And what does a problem address? And what does a problem address today? And so you want to look at that particular area in your CPT book in the AMA description regarding guidelines. I'm going to share my screen and we're going to dive into it a little bit. So to begin, once you find your particular area that you're coding for, you look at the place of service, you see where the service is being done, whether that's the inpatient, the outpatient setting, nursing facility. You come to the problem address, like what is being addressed today. And I love how they break it down about a problem being addressed. Before, when we talked about the 95 and 97 guidelines, when we review documentation, we would notice oftentimes that they may just have in the assessment and plan patient, if it's a cardiologist, patient following up with endocrinology for diabetes, and that's it, right? And so now the AMA is saying that is not considered a problem addressed. So let's dive into it, right? What is a problem? So a problem is a disease, a condition, illness, injury, symptom, sign, finding, complaint, or other matter addressed at the encounter with or without a diagnosis being established at the time of encounter. And I think that's important, right, to understand what is a problem. Not every visit you would establish a diagnosis yet. Maybe a patient came in with signs and symptoms, and the provider is unsure of what's going on with the patient, and they're still working the patient up. So there's no definitive diagnosis yet at the end of that visit. It's going to be signs and symptoms, for example, if you're in an outpatient setting that you're going to be coding for. So that is what a problem is. But let's talk about what a problem is addressed for this date of service. So a problem addressed is managed when evaluated or treated at the encounter by a physician or other qualified healthcare professional reporting the service. So for example, nurse practitioner, PA, midwife, right? And so on. So this is a service. So this includes consideration of further testing or treatment that may not be elected by virtue of risk and benefit analysis or patient, parent, guardian, surrogate choice. Notation in the patient's medical record that another professional is managing the problem without additional assessment or care coordination documented does not qualify as a problem being addressed or managed by the physician or qualified healthcare professional reporting the service. You see that? So they're saying, just saying, if you're a cardiologist, just saying that the provider is being followed by that endocrinology for diabetes does not count as a problem you addressed today, right? Unless documentation clearly states it. Referral without evaluation by history examination or diagnostic study or studies or consideration of treatment does not qualify as being addressed or managed by the physician or qualified healthcare professional reporting the service. That's important. So if a patient just comes in for a referral that day and that's all you're giving them, that does not count. For hospital inpatient and observation care service, the problem addresses the problem status on the date of the encounter. So the date of encounter, the problem you're addressing today, which may be significantly different than on admission. So what you're seeing the patient for today may be completely different for why the patient is being admitted into the hospital. So we're looking at that date of service and the problem that you addressed that day. It is a problem being managed or co-managed by the reporting physician or qualified healthcare professional and may not be a cause of admission or continued stay. So all of this is important when understanding what is a problem being addressed. So for example, if it's nephrology that the patient's seeing and following up for CKD, and we know there's comorbidities and the patient also has diabetes, and the nephrologist goes to the lab, notice that the A1C is elevated. It's a bit concerned about the elevation, right? And want to get on the phone, picks up the phone, calls the endocrinologist, speaks about the coordination of care regarding managing that patient's diabetes. Because guess what? It's affecting the CKD as well. Taking that thought process in, the documentation supports, and it's documented that they had this conversation with this provider in managing the patient's condition and the diabetes and the blood work and mentioning, yes, the patient's going to follow up with the endocrinologist, but we see the thought process and we see that there was some management of the patient diabetes that happened within that visit. That is a problem addressed and we can count it as one of the problems. So as I teach when it comes to the CPMA, or when I'm teaching CPC, or when I'm providing education to organization or physician private practice, I always start off with talking about what are the problems that you're addressing for today, right? We're looking from the chief complaint all the way to the history and the exam or medical decision making. What is being addressed in today's visit? And is it clear? Is your thought process rolled out from your head onto the paper? And that will help us going forward. So I hope this was helpful. I would love if you guys share, subscribe, leave a comment. Let me know if it was helpful. So we're going to keep diving into this. And again, remember the evaluation and management codes can also be used for telehealth. So you see where I'm going here, right? We're going back and forth, but you want to make sure documentation is also clear. So thank you for staying compliant with KW Advanced Consultant. I am looking forward to seeing you on the next video where we continue to dive into evaluation and management, and we're going to go back to telehealth. We're going to go back and forth. All right, you guys have an amazing day. Bye-bye.